If you've got sinusitis, and when I mean sinusitis, I mean a blocked sinus here, here, or here typically, and you get lots of pain. Sometimes you've got a blocked nose, lots of sense of smell, and you can get green, brown, sometimes bloody stuff coming out of your nose. If you know you've got sinusitis, you've been told you've got sinusitis in the past, the way to treat it is to use a few different things. You can use a decongestant nasal spray, such as Otravine or Sudafed nasal spray. Don't use it for too long. I think maximum about 4 days if you possibly can help it. Use a steroid nasal spray as well. Using steroids reduces the inflammation in your nose as well. It doesn't work very well, but you don't want it to become a chronic problem, 12 weeks of pain in this area. The other thing you should do acutely is to use a Neil sinus rinse, a big bottle of salt water. You put up your nose and you squeeze gently so it goes round your sinuses and clears out all this pus. That's very useful for people who are pregnant and things like that because you don't want to use antibiotics and decongestant nasal sprays aren't very good for the baby, all those sorts of things. So flushing out the sinuses works really well. You get rid of all that pus, at least you get rid of the pain. You still have the infection, but at least you get rid of the pain. And if you see a doctor, they often, if you've got proper terrible sinusitis, they'll give you antibiotics, typically something like coamoxiclav augmentin and things like that, that get rid of the infection in the lining of your sinuses. And then you need to think about how to avoid these things from happening again. So if you keep getting these acute infections, what you need to do is unblock the sinuses so it doesn't keep getting blocked and causing these problems.